Hi, I'm Chanelle. Nurses from the Royal College of Nursing are taking strike action on the Isle of Man, calling for fair pay and safer staffing. I went along and spoke to a number of members about their concerns. I am standing outside Noble's Hospital. We've got cars honking, we've got people cheering and chanting outside. And the Royal College of Nursing, they're here striking today for fair pay and retention of staff. Most people will remember last week some members took part in a peaceful demonstration leading from the hospital through the streets of Douglas. This morning I'm standing with Maggie Heaton, the Northwestern Isle of Man Council. Maggie, tell me, are you happy with the turnout today?
I'm very happy. In fact, I'm overwhelmed with the turnout. Yes.
Right, and leadership for the Northwest, for England, have all come out today. Does it highlight the seriousness of what the RCN is calling for?
Yes, it does. We need safe staffing. We need fair pay to encourage our new members coming into the profession. Otherwise, we're not going to get any improvements.
And what's the feeling like on the ground?
Well, on the ground, we just feel that our members aren't being listened to. They need remunerating for accordingly, really. Manx Care cannot address the problems of recruitment and retention, and sadly will remain in a constant state of delivering substandard care, which compromises patient care on every shift and every location of care. Enough's enough.
Right. Now, how do you think patients would feel seeing a disruption today due to the strike action?
Every one of us are caring professionals. We have consciences. We're all aware our patients' needs and our colleagues struggling harder than ever today who are working to support this action. They're preventing the harm to the patients today who are currently in need of nursing and nursing support worker care. This is what has brought us here today. Our wards are understaffed and our patients are dying. Not because we are striking, we're striking because our patients are dying.
And what's your message to the Department of Health and Social Care and Manx Care?
We're a female-dominated profession, and it could be interpreted that offering us £1,000 payment and the police a male-dominated profession, £3,000 as discrimination. We want all professionals recognised and remunerated accordingly, but where is the justification for this disparity? Nursing is a complex, highly skilled, safety-critical profession, but our newly qualified nurses are only offered £25,000 a year following a 3-year degree training programme, whilst a police constable gets £31,000 following their basic training, which is less than 6 months. They're paid £6,000 per year more than our newly qualified nurses who have to undertake a 3-year degree programme. So where's the fairness?
We are still having to call staff in so often. We've got an extortionate number of staff who are having to be medicated for depression and anxiety disorders, and our patients deserve much better than exhausted, depressed, anxious staff looking after them. And I feel that paying people better would help with our recruitment and retention with that.
Right, Claire. Now, during the peaceful demonstration last week, you were one of the members selected to address Tynwald when the gathering would get there. After the gathering arrived, the RCN weren't allowed to address. What went through your mind at this point, not being able to have your voice heard?
It was just disappointing, really. We'd met with some of the ministers a couple of days or a week before and thought that we'd got somewhere in talking to them, and that resolution was being sought, and unfortunately by not being able to address the House, that sort of hope has disappeared a bit, really.
Seeing the action today, are you positive that we're going to see the change that the RCN want to see?
We can only hope. I know we've got a lot out here this morning. There are more people down later. We've got people who aren't in the RCN and aren't necessarily in any union who've come down to support us as well. And as you can hear, we seem to have public support as well from the number of horns that are going off.
And my name's Kate. Okay, so I'm the sister on day procedures.
My name's Pam. I'm the lead nurse for critical care.
I think it feels really good to have all the nurses out together, supporting each other. I think it's something that none of us wanted to do, but I think now's the time that we have to do it.
Yeah, I feel uncomfortable striking. I've been nursing 41 years and I joined the RCN because it was a non-striking union. However, needs must, we want safe staffing levels to ensure our patients are safe.
41 years, how has it changed from what it was to now?
It's changed dramatically, unfortunately, and some things not for the better.
How does it feel seeing leadership from the Northwest, from England, come up and support the Isle of Man RCN members today?
I think it's really good. I mean, they've given us a massive amount of support over the last few weeks to ensure that we do this legally and safely and to ensure that the hospital is covered so that we can do this.
The RCN from the Northwest has ensured and advised us to keep the hospital safe today, so all patients are safe.
Last week there was a peaceful demonstration and we had some nurses talking about tiredness and pay and stuff like that. Since then, have you all seen any changes?
No, there's been no changes since last week. I hope maybe today that might bring about that change. I do hope so. I think we need to do this. We need to improve pay for nurses. We're struggling to recruit and retain staff. And I think the only way we can do that and get nurses to the island is to ensure that they can afford to live and work here. And we need to do it so that we have enough staff to keep our patients safe.
And I would say that we need to feel valued like other members of government workers, and we don't at the moment.
Well, never been a member of a union before. I decided now that the time was absolutely 100% right, and you just have to support the people around you, and it's just, from my point of view, unfair. And you have to do something about it now.
What's the feeling like on the ground?
I couldn't comment for anybody else, but only say for personally, I said I've never been a member of a union before. I decided to join now because this is so important. So I can't speak for anybody else, but I can think you can look around you and see very good bonhomie, lovely team of people, hard-working, all the way through lockdown. These things get forgotten very, very quickly.
It's Deborah Wolfendale. I'm a newly qualified student nurse.
A week later, you took part in the peaceful demonstration and you're here again today for the strikes. Tell me, what inspired you to come out? Or
obviously, as a student nurse, you feel compromised. You do feel compromised because it's all about patient safety and it's all about staff numbers as well. I actually started in the health service over here in year 2000 in a different role, and I was fortunate that because of the role I was in, I was able to retire in 2010. But over the years, I could see that since 2010, nurses' pay have taken a cut every year. And we absorb that, we do absorb that, because none of us join for the money. It's a vocation to deliver patient-centred care, to make a difference to somebody, and that's what drives nurses on. Unfortunately, the demise in numbers is that we're not able to recruit, we're not able to retain our experienced nurses at the moment, and this is impacting on patient-centred care. It's also impacting on the safety numbers. We spoke last week that the government were able to put forward unsafe staffing figures for the whole 12 months last year, and every month we were in the red throughout the whole hospital. Obviously, making a decision today to strike doesn't come easy to nurses. It goes against everything that we hold dear to us, but it's just trying to get the government to hear us, to be able to say this is the impact it's having on patient care, this is the impact that having lack of nurses, recruitment and retaining. We have to have an investment back into nursing to be able to get the patient-centred care back that they deserve, and to lift the morale of the staff as well. We're here to provide that care, but you can't provide the care when you're so thin on the ground and you've got patients who see how busy we are and how short-staffed we are that won't even call the call bell. And to us, that's an absolute tragedy that they won't call us because of that.
Historically, has it always been like this, or is it just the first time, or are we only seeing it now?
I think historically, nurses have always absorbed the monetary side of it, because when we join up, it's not a monetary profession, it's a caring profession. And the tide changed when we could see the last 3-4 years that actually staffing numbers were having such an impact on patients. And coming out today, striking today, was such a difficult decision for all of us. And people that don't necessarily agree with us coming out are saying, well, all the patients have been cancelled today, the outpatients and elective theatre. But then when you go and speak to the patients have been cancelled 2-3 times already. They've got to ward as an inpatient and then had the surgery cancelled because there haven't been enough staff. And that impacts on them and their families. And we've been so surprised today. You can hear the actual support from all the public and the patients. And it was the patients' thoughts that we, to be fair, thought would have more of a negative effect, and it hasn't. It's had complete opposite, that they are behind us.
Can I start with your name, please?
Yes, Tracy.
And it's your last day today.
Yes, I retire today.
You've been with the hospital for 30 years. It's your final day today and you're out here striking with the RCN.
Yes, I am. I'm striking for safer working place for patients, better conditions for the nurses and the nurses that are coming on. We want to breed Manx nurses on the island. If they see how they're being treated, we're not going to breed our own nurses. It's just terrible, really. I'm here for everybody else. I've done my time, been proud of all the work that I've done, but we do need better conditions to be working in, really. And we need to be heard. For years, nurses have never ever gone on strike. Patients are still being cared for today. Levels will still be met, but we need to be able to provide a good environment for upcoming nurses as well.
Taking the decision to retire, was it an easy one?
Personal circumstances.
Right, and from your time here, is there any fears that you have or any advice that you have?
I think nurses just need to speak up for once and be heard. Our voices are important. We go to work every day. We make a difference to patients every day. We save patients from other people's decisions. We save lives in more manners than one.
And what you're doing today, it's not just for you and your colleagues today, it's for the next future generation.
Future generation, because if we don't start to be heard, we won't have a future generation.
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.